COVID-19 public health emergency may be officially over, but millions of Americans are still living with long COVID symptoms. Jess Arnold spoke with a mother and her son from Virginia who both fall into that category. And Jess joins us live outside Children's National Hospital. So we know these two are also a part of an advocacy campaign, right, Jess?
Yeah, to keep masks in healthcare settings like here at Children's National. They say it's a simple step that really helps them tremendously because, as you're about to hear, catching COVID has completely changed their health and their lives.
Any infection can leave him bedridden. And I know that because I experienced very severe long COVID early on, became bedridden, lost my mobility very quickly, almost starved to death several times.
Cynthia and Aiden Adenig, who live in Vienna, Virginia, caught mild cases of COVID in March 2020. Months later, mysterious symptoms started showing, like severe allergic reactions and elevated heart rates.
Technically, I really am disabled, mostly homebound. And sadly, last year, he went from having loud, unnoticeable long COVID to, after playing with friends, heart rate fluctuating, oxygen fluctuating.
The second I came in, I automatically felt it. And then I said, Mommy, what is happening with my heart rate?
Cynthia says they've had trouble getting proper treatment, even getting doctors to believe them about their symptoms, which is why they've joined the COVID-19 Long Hauler Advocacy Project's Week of Action to keep masks in healthcare settings, even though the official public health emergency has ended.
We should have at least one safe space.
This is just the latest step in Cynthia's fight for long haulers. She's advised legislators on multiple long COVID bills over the last few years, including Virginia Senator Tim Kaine. In March, he and other senators reintroduced a bill that would improve research, access to resources, and education on long COVID.
Unfortunately, those of us from the first wave definitely experienced improper care that made us worse. And that's the last thing that I want for him, because he has such a bright future ahead of him.
Now, the CDC estimates that about 1 in 13 Americans are living with long COVID symptoms. So this is a pretty significant chunk of the population. So as researchers continue to study these impacts of COVID-19, Cynthia and others you saw there as part of that advocacy project are really asking doctors' offices, hospitals, any healthcare settings to continue mandating these masks so they can at least feel safe going there.